Hi, Dr. Ramos. So glad you could join us for this Healthbeat story. Some interesting information out of Duke University where you happen to study an MRI. They've been around forever, but they may actually detect a potential silent heart attack.
Well, it's really interesting. When I was at Duke 30 years ago, I did a study looking at the electrocardiogram and trying to determine how sensitive it was in terms of picking up heart attacks. What we recognize is the electrocardiogram can tell if you had an old heart attack, but it's not always doing that.
Okay, so by using then different technology to try to pick that up, what can that show?
Well, some very exciting stuff has come out of Duke. Recently, MRI, cardiac MRI, has advanced to a level at which we can now see areas of prior heart attack that we never would recognize on an electrocardiogram. Problem is that the researchers really never knew what to do with that information. Now they have prognostic information. They can determine that that kind of scar really has a bad outlook.
What does that mean for somebody?
Well, what it means is, at least in this study, and it was a small study, and remember this is an early study, that those individuals who had silent heart attacks were 17 times more likely to die over the next 2 years from heart disease, 11 times more likely to die because for any cause at all. But this is important information. It may be a sea change in terms of how we look at patients.
No kidding. So if somebody comes in and they are perhaps at high risk, is this something that doctors may now recommend as a test?
Well, I don't think right now, but I think in the future it may very well be. We don't do such a great job right now. This looks like something for the future.
Okay, that's huge, Dr. Ramo. Thank you very much. Hi, Dr. Ramos. So glad you could join us for this Healthbeat story. Some interesting information out of Duke University where